Welcome to a conversation with Dr. Jonathan Woodson, Larz Anderson Professor in Management at the Questrom School of Business at Boston University. He's also Director of the BU Institute for Health Systems Innovation and Policy and former Assistant Secretary for Health Affairs in the United States Department of Defense. I'm Ken Freeman, Allen Questrom Professor and Dean of the Questrom School of Business. We're pleased to have you with us. And John, we're very pleased to have you join us today.
Pleased to be here.
Let's start with a conversation about your background. Tell us how you got to where you are today.
You really want to go right into it.
Way back, yes sir.
Yeah. Well, I was born in actually Western Massachusetts, but really grew up in Brooklyn, New York, the mean streets of Brooklyn, as they used to call them back then. And, you know, sort of a product of the everyday neighborhoods there. But really had an opportunity in the public school system, and so I want to make a first plug for public education, that it can be great, it has been great, and it has done well by me. Mm-hmm. When I went to high school, I was very interested in the sciences and biology and went to the Sheepshead Bay High School, which had a marine biology program, and I thought I was going to be a marine biologist. And part of that was the era of Flipper, and the thought of living on a beach and studying oceans were very attractive. But there's a sort of interesting story there, which is about broadening your horizons. And so one day I went to a career fair, and they were talking about the careers in medicine, which I had never thought about. And I said, this is even better, you know, biology people, and impacting their lives. And so I was accepted to a 6-year BSMD program in the city, a combined NYU CCNY program, the first of its kind. And as they say, the rest is history.
Wow. And so you got your MD at NYU, mm-hmm. And along the way you also served our nation in the military mm-hmm. For 25 years. Mm-hmm. How did the military become part of your experience base?
So despite being a child of the 60s, I was always motivated by doing service to the nation. And particularly military service. My uncles and my dad had all been part of the World War II Korea scene and spoke very honorably about their service. And despite the fact that they grew up in a segregated military, they were very, very, you know, appreciative of what the country offered them, and were very honored by their service. That was an important part of their life, and so that rubbed off on me.
Yeah.
Yeah.
And in terms of your medical career, you took the surgeon path. Mm-hmm. You're certified in a number of different areas, primarily mm-hmm. vascular surgery, but well beyond. You've been named a top surgeon in the United States. Mm-hmm. How did surgery become the passion within the world of medicine?
Yeah, so good question. When I came out of medical school, I was mentored by actually an internist, and went into internal medicine and completed that. But everyone told me around who were, you know, teaching me, and my fellow residents said, you act more like a surgeon. And I think what it was is that I was always drawn to the toughest cases, the biggest challenges in medicine. And so surgery really is not only a personal challenge, but in terms of the group of diseases you deal with, it's a challenge for your career. You know, as someone once said to me as a mentor in surgery, is that you can never take the scar back. And what he meant by that was, in fact, that what you do in surgery is immediately evaluated by everyone and can be judged. And so you've got to be disciplined, you've got to have great skill, you've got to apply that great skill. And that kind of intense activity drew me right to it.
You love the pressure. I love the fact that there's no second chance.
Right.
Amazing. Right. Now, you were affiliated with the Boston City Hospital, and then through the merger, the Boston Medical Center for a number of years. And I can only imagine you're sitting at your desk or in the operating room, and all of a sudden you get a call saying, we'd like you to become Assistant Secretary for Defense. How did that come about?
That's a very interesting question. So never on my radar screen, right? And you know, at some point we'll talk about building the toolkit so when the opportunities come along you can take advantage. But not on my radar screen. And in fact, I was not in my office when I got the call. I was actually on one of those mini vacations with my wife, and she had taken away my BlackBerry because she wanted me to concentrate on the activities of vacation. But she must have thought I was going through withdrawal, and she gave me my BlackBerry back, and there was a message to call the White House. Originally, I thought it was just one of these routine things because I was a general officer in the reserves, and sometimes you get asked to be a ceremonial representative at certain affairs. But you know, the conversation took a different turn, and in fact, it was a request to be considered. And so one thing led to another, and there I was.
What an amazing honor.
Yeah.
Such a privilege and
Yes.
honor to serve the United States in this way. Now, as you went through the process, you mentioned talking about the toolkit that you developed. The lessons learned about how do you prepare yourself for the possibility of those very special phone calls or career moments that can take place in a person's professional life.
Well, I think there are a couple of things we need to think about in life, and when I talk to students and I talk to young faculty and young officers, is I always say, number one, life is what happens when you're otherwise making plans, right? And that you need to constantly learn to live outside of your comfort zone because that's where you're growing. And so I think the issue is that over the course of my career, I've gravitated to sort of tougher situations that have challenged me and to leadership opportunities. And one of the things, of course, that my experience in the military clearly gave me and actually insisted upon as I ascended the ranks was to try out and challenge your leadership abilities. And that was transferable into the civilian sector, and then one thing leads to another, and suddenly you've got the right mix of skills that people will look at you for to lead organizations that are going through change or need to go through change.
So that willingness to take a risk, to experiment, to focus on gaining specifically excellent results is along the way. Very important for you.
So in fact, I would say it's essential. It's not just important, but if you're not willing to take a risk, you will never develop your leadership abilities, and you certainly cannot lead in the strategic leadership environment.
How did you overcome the potential fear of failure? For many of our students these days, across this country and around the world, there's a deep fear of making a mistake or failing. Yeah. How did you overcome that barrier that most of us, all of us perhaps as human beings, at some point have this desire to not fail? Sure,
there's a natural tendency, and no one likes to fail. But you know, one of my mentors said to me, you know, sometimes when you run with the big dogs, you get bit. And so you can't necessarily shy away from the opportunities to put yourself in challenging situations just because at times you might fall short or you might not be totally successful. You clearly will not grow if you shy away from those responsibilities. You cannot be a leader if you're not willing to take on risk and manage risk. And you cannot be an innovator unless you're willing to fail. The key is to fail fast and smart and recover.
Yes, don't let it dwell. Move on, learn from it, and move to the next opportunity.
Absolutely.
Let's turn to healthcare for a moment more broadly. A number of people would say that the healthcare system is broken. What's your diagnosis?
So I do think it needs significant reform. And the key is, again, to understand how we got here, basically, so you don't get mixed up into the emotions of why we're doing certain things and not doing others. We got to understand how we evolved and got here, and then we can find solutions. So the present system, you know, that is based upon employer-based insurance was a long story, but an outgrowth really of frozen wages in World War II. The fact that employers at a time when healthcare costs were low could give healthcare benefits, you know, as a benefit to expand the attractiveness of workers working in a company, and then the government sort of solidifying that by giving it a tax-free benefit. And so there are a lot other parts to that story, but that's basically it. And what we have now is an employer-based insurance program, but it doesn't fit the 21st century. What it is it's an inefficient system that is adding cost, and we're actually paying more than we get in value out of it now. And so at some point we've got to reevaluate what it is we're doing, what it is we're trying to achieve, and make reforms so that it's sustainable.
It's interesting that we have among the highest, or perhaps the highest cost health system in the world, but also our quality. You would hope that with higher cost, perhaps quality would move along with it. But in the end, our quality levels are below many countries in the world as well.
Yeah, so that's exactly what we're talking about. So it's what value at what cost. $3 trillion we spend on healthcare, 18.2% of GDP, and escalating. Healthcare cost expenditures are inflating at a rate that's much higher than base inflation. Yet we rank among the lowest in industrialized nations in terms of outcome, life expectancy, maternal and infant mortality, and other parameters. So you've got to ask yourself, what are you getting for it, and is there a better way? Are there other models of healthcare that can lead us to solutions that need to be adjusted for our culture and the way we think about things? But if some nations are spending half of what we get, have longer life expectancies, lower costs, we got to rethink the situation.
So what needs to be done to right the ship, to make things better?
So clearly what we need is strong leadership. That's number one. But leadership that can bring the various stakeholders together and align the incentives. Because the question really is, whose rice bowl are we going to mess with, right? I mean, that's really what it's about. Whenever we get involved with these reforms and readjustment, it's about winners and losers. And so we've got to create winners and winners here. And just to give you a few ideas, for the employers, it's about reducing their cost and expenditures on employee health care, which provides recapitalization money for them to expand business and compete in the global market. For physician groups, really, it's about reducing the number of compounding hassles that go into practice that are demoralizing physicians. For patients, it's better outcome, universal care, and outcomes that creating a system that's safe, effective, efficient, patient-centered, it's learning, and it's equitable. So it's about aligning those incentives with strong leadership to get us to where we need to be.
Is it possible?
It's possible.
How long will it take?
I think it will take some time. I think the new administration is going to have to deal with some of the issues, but the key is, I think, activation of the stakeholder groups. When it's a grassroots level effort rather than a government level effort, I think you're going to get movement. So when employers come together with consumer patient groups and come together with physician groups, I think there's going to be a momentum that will get us to where we need to be.
More bottoms up as opposed to top down.
Absolutely, because remember, we're in America, and what we believe in is states' rights and more local control, that's how our government was framed, federalism, rather than the issue of a strong central government. And as a result, people shy away from that. And so when the government tells you got to do something, it's usually, oh, no. But when I think grassroots organizations come together and find that common ground, that's where it will get to where we need to be.
The new institute.
Yes.
Institute for Health Systems Innovation and Policy. You're at the helm, you're driving the progress. What role do you see the Institute playing in advancing this very complicated and needed agenda, if you will, in this country?
Well, I think at the heart of the Institute is the model that we are going to be operating under. And what the model really addresses is the complexity in healthcare and the number of factors that need to be considered when you're talking about reform and innovation in the health space. So it's not a simple answer, and I think that's been part of the problem in the past, that single stakeholder groups look at what they consider novel solutions from a very narrow point of view, and it's really like pushing the balloon in one part and having it poke out on another because you haven't dealt with the complexity. So the Institute is going to be a convener, a catalyzer, a facilitator, provide thought leadership, but across the domains that I think are important in driving healthcare reform. So in one domain, it's going to be about biotech development, tech development, and transfer, underscoring transfer. In the second domain, it is going to be about intelligent health system design and operation. In the third domain, which we've sort of touched on already, it's about developing that executive and strategic leadership development, which I think a lot of organizations and a lot of countries are crying out for, how we can train leaders to understand the complexity of the healthcare space. The fourth, I think, is really going to be what's going to drive change in healthcare and accelerate the change in healthcare, which is the issue about informatics, data analytics, big data, and the digitization of healthcare. And then the last is about encoding all of that in smart policy development. We got a lot of not so smart policy out there, and really we've got to get ahead of the curve and create smart policy, healthcare policy.
Comprehensive process, comprehensive approach.
Yes.
If we hone back in on leadership just for one more moment, leadership in healthcare. As the world changes, as our country and others continue to address the opportunity and need to improve healthcare outcomes around the world, what are those essential ingredients for the next generation of healthcare leaders?
Sure. So one of the things is they've got to understand the complexity. So if you go back a century or several decades, physician leadership was a big part, and it was that, if I came out of my medical school and residency and had great skill and gravitas as a clinician, I was therefore a leader. Not so much anymore. There are a whole host of other issues that need to be considered, and there has been an ingrowth, a maturing of other disciplines. So healthcare administrators, economists, nurses. There are a lot of ways to enter the healthcare leadership sort of domain. But the issue is, in the 21st century, there's a much broader set of what we call skills, knowledge, and attributes that executive leaders, and particularly strategic leaders in healthcare, need to be familiar with, know, and have as core competencies if they're going to deal with the wide-ranging issues in healthcare, and be able to bring eclectic groups together and conduct a process to deliver solutions.
So embracing complexity, being able to really work in a very collaborative way.
Yes.
Toward the overarching objective.
Yes.
The recent elections, next president, what kind of challenges do you see the next president facing, in particular as it relates to the healthcare agenda?
Well, I think we've touched on a couple of those things. It's about the cost. $3.2 trillion. That's going to inflate at about 5.6% per year. 18.2% of GDP, which is expected 2021 to be nearly 20% of GDP. You got to address that. You got to address the equity issue. In an advanced, industrialized Western nation, for a portion of its population to be uninsured is just unacceptable. You've got to understand the impact on the individual. Right now, healthcare expenses are the #1 cause of personal bankruptcy, so it's impactful. You got to address the issue of the system and really designing the system so that it is safe, equitable, and efficient and effective. So all of these things are going to come. The pressure is going to come because statements have been made on either side about reforms in the Affordable Care Act. The problem is that there are some people who really like it and have gotten some benefits at it, yet at the same time there are some issues that really need to be dealt with in order to create sort of the holy grail system that we've talked about. So it's going to be front and center. It's going to be front and center. And
Do you see it as one of the top
I
priorities?
do. I see it as one of the top issues to be dealt with. And to some extent, how they deal with it may determine whether or not they get a second term, I would think.
Do you see other, from your unique set of lenses in your career, what other major priorities do you think the new administration will have to face in addition to the health care challenge?
Well, clearly defense is going to be there. You know, the world is a volatile, uncertain, complex, and ambiguous environment, what we call the VUCA environment, and that's not going away. That simply is not going away. There are issues that we'll need to deal with in realigning and reconnecting ourselves with states around the world that would be our near peer competitors. There are abundant issues that we're going to have to deal with in terms of the issue of non-state actors and radical groups that are going to be persistent. So in a sense, we've been in this long war, and it's not going to go away certainly tomorrow. But at the same time, we've got to figure out how to balance defense against the rest of the needs of the society, ensure that we man-equip and modernize the force. And so that's going to be a challenge for the next administration.
Do you see health as being a strategic opportunity for the nation as it engages the rest of the world as well?
So I do. You know, when I was in government, one of the ideas I championed was this issue of this idea of an international global health engagement as an instrument of national power. Thought about differently, it's soft power for good. So some of our non-near competitors, like you know, Cuba, have been doing this for a long time. They've been actually creating an impression around the world by doing good in the health space. We have a lot of assets, and we've got to know how to leverage that for the good of humanity, and at the same time against strategic goals.
You know, as a business school, turning the subject a bit, we're very focused on trying to ensure that our graduates are prepared to be ethical, responsible leaders. Is there an ethical dilemma you might have faced somewhere along the way in your career where you were really faced with a tough choice, arrived at the right choice? And how did it evolve for you? What was it about the circumstance and your personal experience that enabled you to get to the right choice in a very difficult situation?
Yeah, that's an important question and an important part of, I think, ethical leaders' development. And that is, you've got to decide early on in your life what your values are and what your principles are. Most importantly, throughout your career and as you take on new jobs and new challenges, you've got to test them out to see if you're staying true to them. So you've got to understand what your core values are, because that represents the compass. When you get to the strategic leadership level and you're working in that volatile, uncertain, complex, and ambiguous environment for how to navigate and create and continue on to true north. And you know, I've had a number of issues arise, particularly when I was in government, basically. As part of my portfolio and set of responsibilities, I actually had oversight for healthcare of the detainees at Guantanamo Bay. Just think about that as a whole set of issues that people have, you know, delivered opinions on both sides. It evokes emotion. But my true north was that in serving humanity, I had to deliver appropriate and correct health care to those detainees. And I had to make it abundantly known to the system that I was going to not be compromising on that, as a physician, I had a responsibility to deliver that health care. And so sometimes you had to go nose to nose with a few folks, so to speak, in order to make them understand about what information you needed in order to deliver that care. You had to deliver to the men and women who were down there, who, by the way, do a tremendous job and tremendously ethical in terms of their approach about the expectations of the services delivered. So there's obviously a lot more to that, but
An outstanding example.
Yeah,
Thank you
yeah.
for sharing that with us.
Yeah.
John, one more question for you, and I'm thinking about our students who are about to leave this place over the next several years, depending on what year they're in.
Mm-hmm.
What advice would you have for students that are continuing their education, about to complete this phase of their lifelong journey for education? What advice would you have for them as they move forward into the world of work, into the world of striving to make a difference in society?
Yeah, remain enthusiastic, remain energetic, seek out those opportunities, remain committed to making a difference in the world and adding value.
Thank you, John. We've been in conversation with Dr. Jonathan Woodson. It's been a tremendous conversation. Thank you for joining us. And John, thank you so very much.
My pleasure. Thank you.